Welcome, nursing students. Today, we delve into one of the most critical conditions you'll manage, diabetes mellitus. We'll cover everything from the underlying pathophysiology to essential patient education. Let's start with the basics. Diabetes is a chronic metabolic disorder characterized by hyperglycemia, resulting from defects in insulin secretion, insulin action, or both. Type 1 involves absolute insulin deficiency, while Type 2 is characterized by insulin resistance and relative insulin deficiency. Understanding the lock and key mechanism of insulin is vital for grasping how glucose enters the cells for energy. When this process fails, glucose remains in the bloodstream, leading to the systemic complications we must monitor. Persistent hyperglycemia leads to chronic complications, which are broadly categorized into macrovascular and microvascular damage. Macrovascular issues affect large vessels, like the heart and brain, while microvascular damage impacts the eyes, kidneys, and nerves. Now let's move to assessment. This is where your clinical observation begins. The 3 Ps, polyuria, polydipsia, and polyphagia, are the classic hallmarks of hyperglycemia. During your assessment, look for signs of dehydration, poor wound healing, and blurred vision. Diagnostic criteria include an A1C of 6.5% or higher, or a fasting blood glucose level of 126 or greater. A1C reflects average blood sugar over the past 2 to 3 months, making it essential for long-term management. Be alert for acute complications like diabetic ketoacidosis or hyperglycemic hyperosmolar state. Management of diabetes is multifactorial, requiring a balance of diet, exercise, and medication. Nutritional therapy focuses on carbohydrate counting and maintaining consistent intake to avoid glucose spikes. Exercise increases insulin sensitivity and can directly lower blood glucose levels. Frequent self-monitoring of blood glucose allows for real-time adjustments to the treatment plan. Consistency in these lifestyle factors is the foundation of effective diabetes management. When lifestyle changes aren't enough, pharmacological intervention is necessary. Oral hypoglycemics, like metformin, work by decreasing hepatic glucose production and increasing insulin sensitivity. Insulin therapy is categorized by onset, peak, and duration. It's crucial to know these profiles for safe administration. Titration is the process of adjusting the dose to achieve the target blood glucose range. Insulin can be delivered via syringes, pens, or pumps. Selecting the right method depends on patient preference and lifestyle. Insulin pumps provide a continuous basal rate and bolus doses, offering tighter control for many patients. Site rotation is essential to prevent lipohypertrophy, which can interfere with insulin absorption. Always monitor for hypoglycemia, especially during peak insulin action times. Ensure quick-acting glucose is available. A deep understanding of these medications is vital for patient safety and effective care coordination. Finally, patient education is where we empower the individual to manage their condition. Focus on survival skills first. How to test blood sugar, inject insulin, and recognize low blood sugar. Teach the rule of 15. Consume 15 grams of fast-acting carbs, wait 15 minutes, and recheck blood sugar. Repeat if needed. Educate patients on daily foot inspections to prevent ulcers and infections due to peripheral neuropathy. During illness, blood sugar can rise. Patients must know their sick day rules, continuing meds and checking glucose often. Don't forget the psychosocial aspect. Diabetes is a lifelong journey that requires significant lifestyle adjustment. Connect patients with community resources and support groups to help them navigate long-term management successfully. Effective education reduces complications and improves the quality of life for your patients. Mastering these concepts will make you an invaluable part of the healthcare team. Keep studying, and thank you for watching this video. For more educational content, please check out my other videos. Please like, share, and subscribe.